the question. I really enjoyed the conference. It was a great opportunity for everyone working on homepage monitoring to meet, share ideas about innovation and collaboration, and look forward to the next meeting.
Yeah, it's been very interesting, and it's been very informative, and a great opportunity to meet a lot of people.
Yes, liked it very much. I think it's amazing to bring people from so many fields together around a common technology that we can sort of learn from each other. We can learn what the behavioral scientists are doing that we can use in metabolic research. So yeah.
It was great. It was my first digital forum and I really loved it.
The meeting is great up to now. I mean, we've got a very nice group together with people who use the DVC in their research in different areas of research. We've got together data scientists, we've got technologists as well, lab animal scientists. So it's a good group together and a good number of expertise together to actually discuss what the DVC can bring and also how to move forward.
Yes, I liked it very much. This is the best forum to get the newest information on home cage monitoring.
I found really interesting the different innovation that's going on with new technologies to identify new endpoints in the home cage. I think with these innovations, these new endpoints will really advance our ability to detect phenotypes in animal behavior, and it will improve both research and animal welfare.
I think the most interesting thing to me is just the whole breadth of work that's been done now with home cage monitoring and the number of different scientific fields it's been applied to.
I think the most interesting part for me is being on the front edge of what is being developed and hearing about all the different ideas people are having and how they are using the system and how they are expanding the use of the system, adding new functionalities and coming up with ideas for new data analysis approaches. That is something that we try to do a lot, and it's very helpful in our work.
To meet a lot of new people, to see again old faces after a few years of restriction because of the COVID and a lot of kind of segregations, and also to discover that there is a huge interest in increasing the understanding of our animals and increasing the welfare and thus increasing the level of science.
Well, interesting is to see where models are being used and where researchers have questions, and you see that the DVC, as it is at the moment, can answer some of the questions, but it generates immediately also new ones. So actually to define them and to see how you can address these new questions with new technology and new technological developments is a challenge, and that's very interesting to see that, and it's a good thing.
I find the most interesting was the in-cage food consumption device, and that will help our diabetes researchers a lot.
I think everyone who's working in home cage monitoring should come to the meeting. It's really a great opportunity to meet and connect with similar colleagues working on similar topics, and this type of collaboration is needed for the field to grow and to advance.
Yeah, I think certainly it would be really useful for a lot of colleagues, and I think one of the great things has been the different technology, and it may give a lot of people ideas for experiments and things that they could address problems in their field.
Definitely, yeah.
Absolutely, yes. I think that DVC should be used and used and used more and more, and digital technologies used by a lot of people more and more, and so I absolutely recommend this event.
Oh yes, definitely. I think this is a great opportunity for an emerging technology, and you see that a lot in science, where there are emerging technologies that early adapters, people who use it early on, and those communities are really then the strength to take this further and to develop it further. So I can really recommend to actually join this community and discuss this further, definitely.
Yes, of course. I would suggest it to our diabetes researchers and also to our behavioral researchers.